Ngiyanamukela uhlelo ezempilo zwamonakalo Dr. Pro. Namhlanje sizobe sibuka udaba olubaluleke kakhulu lokufana ohlangothi lokho sithi phecelezi i-stroke. Kanti angihambi ngedwa, ngihamba nomlingani wami uMr. Luthendo Phaswana. Lu.
Right, sibonge shenge. Luthendo Phaswana, i-host of Mshumisana Prudence and Nimsinande Ramanenjo. Asinande Vachiwona. Shino namusi swauda uthi nendrotendo mwezi wa November kanje rivariko kusenziwa kapungo la stroke kana ufaro kumbu azviwo kachivenda. That's why I'm just saying stroke. We're going to translate ufakachikuwa or in the medical term to say ufaro kumbu ngori kachivenda ari rumbu of something is wrong from the end of when it's mining there's more stronger traditional healers in Guyana. So we live via Guyana from Venda or Masebunzima, Kulbeses Lando Mteshana, Dr. Mteshana. The case at 10 to Okonos, Ran, Obama, Nessim to that. But La Sikuluma, near the medical one, is stroke and Masinje. So decided to tell them, oh, today's Mathye specialist, Manchester, kula abantu bafika kubo kali. Say not only that, the patient now who spethe u Kele Motshwane, spethe Dr Mteshana, spethe Dr Mathye, spethe Drs Nkabinde. Bazosho bona ukuthi bayenzani bonke. Oyiwane ngisho kuphela. Wasumke. Kele is our patient. She will tell us what kini I experience it. Uko kai onano. Wezala handledly unano king have a stroke. Yena nazi wana stroke or unomakalole. Weza I think more but in reality, Rotaba Barabisi Bachi Kuda Badiuri Arabiwana stroke. Bakweka, bato tumangani, bakweka chista casualty badwanani, abayitamini, avapo ayakai, usika une hapa usinkele abawani, yako akononda, ata studio, rakono result uti, mtoto oba ona stroke kuitia minika, ndiyeso, namasi.
Dolo Namandalu.
No, those are shy.
Kufanele uhlelo zwamonakalo sibambe khona lapho sicale ngayo uDr Mathye. Dr Mathye ungamchazela umbukele ekhaya uthi ubani uDr Mathye, utswakayi, uba specialist physician king yona kanti libala kayi libala mwakamikayi.
Okay. I'm Kele Motshwane, ngonamngani wami program le1. Mina Dr. Mathye akaya Limpopo from a small village called Kapungeni. In theory, I'm a specialized physician. My journey started when any medical university enter program with an Bachelor of Medicine and Surgery. The entire South Africa university total and at medical universities. Normally, it takes which is 6 years. Training as an intern and then nearly enter community service, the medical doctor. Was an African and decided to specialist. So, who are a specialized physician, a program they take up at least 4 to 5 years. The train over a specialist. Kunati university total related to offer a program one. Inante waina leswi endla swona hi vona vavabyi especially vanhu lava vakulu a hi voni vana a hi tirhi ngopfu hi vanhu lava va nga yima emirini and a hi endli ngopfu swilo swa vuhandzuri meaning we don't do surgery. So mavabyi lama hi delanaka na wona mavabyi ya tele swinene. Ekanyingi swo fana na vo ti-high blood, chukele, loko ri na vuvabyi bya xifuva, switeletelo na vuvabyi bya xivindzi or na vuvabyi bya ti-kidney ku va wu hundza hikwalaho ka yena.
Right. Sibonge ke Dr. Mathye, you know, look how I would. Basement and Dr. Madan Monangaku, Fanayana, you know, Malembera, Ate, like Miss specialist, but she was also dedication. Shop missing figure, but important because the Google like stroke, Shachuizanyana, man. So I think there was somebody who taking care of the nationalists. So anyway, no, Dr. Nkabinde,
Dr. Nkabinde, neurosurgeon. So, ekhaya kusembalahle secondary Mpumalanga.
Okay.
So, ngimatriculate eKusasalethu High School khona eMbalele. I-journey yami in the health field iqale kaBhokweni Nursing College.
Oh.
Yeah.
Umkhaya
yeah.
Okay.
Then ngiyaqhubeka kanjalo I completed the diploma yakhona and then realized I can do more. Then
So that is another calmness which I can do more. Yeah, body calmness. I can do more. You know.
Then I joined Midlands. I completed a BSc degree. My majors were physiology and biochemistry. That's when I joined. Dr. Ted was my classmate.
Serious?
Yeah.
How much of yes, you will carry the corner. Mustn't take those cousin. This cousin, not the tablet, and it told you that. Any names and the book again, good night. No. So now I'm a classmate.
Yeah, we used that from first year to final year in medical school. Then the journey is the same. Internship and community service. Then I decided to okay, now I want to do neurosurgery. That's when I joined the program 2013. So the journey took 5 years.
Okay.
Then I completed after 5 years, got my registrations, and then I started working as a specialist.
Complete now after 5 years, you found the university.
I went back to Medunza.
Yeah.
Basic medical degree in Medunza.
Yeah.
Then after completion, I went to community service and like internship and community service. Afterwards, I came back to the same school again to specialize in neurosurgery.
But in time we were now college, basically university man.
Okay.
We beg a thing is to teach
Gonna train on my institutions I too with the specialty part, especially of recent days.
Yeah.
Before we were named meant the master's degree.
Okay.
It was offered by universities. So abantu bebavumela back then which they can practice as a specialist with the MEd pair. But ngoba isikhathi sihamba, now you have to have MEd the fellowship of that particular field. So a fellowship we told her through writing exams in the College of Medicine of South Africa. So you're the controlling body now that it conducts my exams while my specialist. So at the end of the day, masuqedile bonke uphuma nama degree ayi-2.
Okay.
It's the MEd and then the fellowship of
at the same time.
Even the research component the MEd
No wonder when is a specialist. Man. So yes. Verse from there we are telling
So ilapha khona manje as we are recognized as a specialist, but the journey benjalo
specialist son.
Mina neurosurgeon shothi sidila nama problems with spine and now brain. Like injuries zenhloko nje in general from the outside to the inside, the brain itself, the vessels, the fluid khona lapho, spine, the bones, and the spinal cord itself. So you want to seven.
Sure, Tina was told to navigate. Keep it brain, fat if yes, it's right. Oh, okay, but to seven is work. Dr. Mteshana, when I told him or now we patient, we specialist, we find a man, we host.
Okay, we are Mathye and Mteshana. Okay. I know Mteshana outriding is a single show.
Oh.
Goksuga dabuka KZN. Umasipala wamuzwabantu but babiza ngokuthi sehiding.
Okay.
Ngifunde khona high school yami sephambili high school then ukufundela isifundo zobudokotela ngabe University of Cape Town. Ngafunda khona ngahamba ngaye eMaritzburg ngakwenza community service nezinye izinto but futhi ukufundela ubudokotela ukuba udokotela abantwana ngiphinde bekhona eCape Town. Bengitrainer Red Cross Children's Hospital and
the famous Red Cross.
Yeah. So then go 2017 ngathola umsebenzi khona la eGoli. Ngisebenza kwi-public sector so angikho private. And ngisebenza ku-department edila ngengqondo nakhona sibiza nge-neurology. So ngiqalile i-training yami khona kuba-pediatric neurologist. So kahle udokotela abantwana udila ngobuchopho ezinganeni.
Mina abantwana ubuchopho busasebuncane udilani nawo.
Sithanda bona lobo ubuchopho busakhulayo. So izinto eziningi ezimenshiniwe uDr Nkabinde sidila ngazo but thina asivuli indaba asiqhaqhi indaba nje so medical so ubuchopho spine ama-nerves nama-muscles esidila ngakho. And yeah, that being said, I must never forget because you asked me who I am.
Yeah.
So Ngumagaleto was a beautiful boy.
Okay.
And Gijimi for the second complaints that time.
Gijimi lo wespire make a short to sustain space much oh, but you're an athlete more than anything else. Okay, yeah. I think that's beautiful.
Kuhle kakhulu lokho siyeva udokotela uyafunda umhake wengane Dr. Mteshana ukhopha kanjani kwenza kanjani konke nje lokho
engakufunda komunye umngane wami naye udokotela specialist wathi singabuzana ukuthi sibe ama-superwomen so thola usizo la tholakala khona so masho ukuthi ngidingosisa abasebenzayo abawu-2 mangibathole abantu basekhaya mabekhona available ukusiza nabasiza ngoba kunzima ukuthi uzame ukumanage izinto zasekhaya nezasemsebenzini especially besikhuluma no-Dr. Nkabinde la ngaphandle ukuthi sifunda into engapheli abantwana bayacomplain usuyafunda futhi
ile nto ngisho ukuthi ungathi ifuna isineke. You know, this thing where you have to have so much patience to get to the level. Nursing, why is this? So, Tina man, that's why we maybe is what Tina mustn't get any time. Low proper, not where we lazy now. This is fine. You and Master Sasa and maybe about can't about tint, not to see. Because tunazaza abantu abenza medical courses twa umbona sesemncane ehlakanipheke kakhulu asimfuni nomfundo because ufuna sikhulume maths manje ufuna udlala ibhola yena ufuna sikhulume all these things and we think man net makahambe
sibonge kakhulu lapho awuske ke kuba ukuthi ubuwe imuyi kuhale uba ukuthi ngikima awuske utswa kayi kanti khona jwalo kuba ulimo utolisa kastroke
Kele Motshwane kisamo jobe no kini stroke hakili 42 in 2012 and the signs were there. I was presenting with symptoms of a stroke, the blurry vision, blackouts, and numbness on my left hand side.
Okay. And then when you say blurry vision, blackout, were these things needed to take from time to time, or at the same time? This
No,
or
it's on
the
the 24th of September,
yeah,
and then I went to the hospital on the same day.
same thing. Okay.
So they did a CT scan. Then the neurologist who at that hospital said I must come and see her on Monday.
Okay.
So I went to her. She was struggling with my case, fully keen. Or checked everything like living Gantaki, on a Hanaki platelet saga, and then she wanted my family history. So, because my mother had a heart problem, maybe that's why, maybe genetic, whatever I was suffering from. But she couldn't really say what it was. So I would live there not knowing how it's working, and I would get is this strong? I feel. For the whole week after the 24th, until on the 3rd, my dear, at least about 3 times, I feel like I'm dying. And Unahena, she's going to France or somewhere for some conference. So my thing was, okay, when you take the Hippocratic oath, I mean, I've been there, I've been in that ceremony, I'm not the medical person, but even as an ordinary person, I was moved by, hearing these doctors making that oath, taking that oath. But then she chose, the conference, instead of maybe referring me to somebody who maybe is also a professor, because they are professors.
Right. I'm sitting here and I'm listening. September, is it September this year?
No, 2012.
2012.
Then
So
on the 7th.
this is now 9 years later.
Yes, 9 years post.
This, yes. And I think I'm asking this because nilamtewe na dokotela swaku man i-patient wayahlamisela swaku kwendlekini kwendlakala yini kasi so yini why abatsandzeka or abangavuli swaku kwendlakala yini stroke kahle kahle.
Okay, so stroke, Ishtonga antiveritura, Leri Vula stroke exactly Marai, Narangeta Shamsel, Amarina. Stroke, Ekuba, Azongwe, Unamsia, the families of that. So Lukoba could disturb a Kamsia there. Either see a one Bunga blockega, Umbeshani, Ubalega. So the one is also a presentation, the one is stroke. Example, example, let's take Laufamba. If you have a river and there's flowing water, and if locals go below Kele Motshwane, local Ponasha are 9 years, until also Fula Malamaya Tela flow of food. Another one year stroke, locally, Nambuan, Wofika disturb Baker. So soon like a hala na so it's not disturb and lay much.
So uhlamsile sis nasitwa siulana satingati asifambi so ausgere comes in uhlamsa uyihlamsela the way I hlamsela go. Does that tell us are those typical symptoms of a stroke? Is this what we are supposed to experience? Okay. And how long do they stay before they burst into actual, or this is complete stroke, now when, how long does it take?
Okay, so let's show with stroke, let's It's one of those like the typical presentation that stroke. Mara one wakuma stroke shaka and tell one the muga like tolovelangi. One okay, ana go to the sabo on energy, ana go to the sabo. Mara aba ask what up langula na penteres man. Or Meshana is one of themselves one like just a momentary blindness.
Okay.
Na swalelo swa ngaba sign na stroke or kumeshani what kunga ukula for ngalo mara kanyingi ni dankari wa kuringana 24 hours ukubona okay the signs there after at least after 24 hours kuna the signs totala what I call mara ngalo stroke shateka more than 24 hours kuba shidelo aswa style kansomo Woman says with an stroke in evolution.
Oh, okay.
Okay, so the Shan Makumili Munasuna, okay, Marana to cast on lots of sensation, Marana taken for pain, and so. Then the following day, I found out vocal around week. Then after like 3 days, they are not
okay. I think and it's very important to then look so because hey, there's a stroke show says you nearly time so shiny pan whether I'm way stroke and I got into so this comes out if I like check every day so she from Banjani na Mary
Shinambo wangu primaku loko stroke ulabula in medical terms we say time is brain.
Oh yes.
So loko kuna damage there shinambo kwa ata ufika ashibhedlela or clinic without one before ubana damage inkulu azongwenza wena.
Okay.
Leso sinangoka kakhulu determine okay recovery ya munhu itaba njani. Sinangoka ka outcome.
Drs Nkabinde, njengoba asikele asho ukuthi wafa uhlangothi lama-health. Njengomuntu osebenza ngengqondo, ngicela usithathe nje usibekele isithombe ukuthi kanti ingqondo le ino-left no-right kwendakalala engqondweni uma ushawa istroke yeni kwendakala lapha engqondweni usibeke isithombe nje.
So ngendlela usisikele achaze nayo ukuthi wagcina yena abane-weakness ku-left and njengoba ubona clinically it looks like ube ne-stroke esibambe umthambo ophakathi nendawo okwa-right. It's in the middle cerebral artery distribution stroke sakhe the way sibonakala ngakhona clinically at this point. So kusho ukuthi ma ubuyele emuva umlalelisisa kahle uchazile ukuthi bekaloku anama-sign engathi kukhona okwenzana engathi akaboni kahle. Those were siwabiza ngama-sentinel symptoms or sentinel signs like ama-warning signs ukuthi something bad is going to happen.
Oh, okay.
Chopho lokhu before isikhathi esiningi before i-stroke sibakhona kuba nalawo ma-warning signs ukuthi something imminent izokwenzeka. So bekuloku kunalawo ma-warning signs and nawo ayakunikeza a slight idea ukuthi kungabe sikuphi kakhulu le-stroke. So i-stroke kahle njengoba Dr. esachazile ukuthi unokuthola i-stroke ebathi i-stroke in evolution. Leso stroke kusho ukuphazamiseka komthambo lo uhambisa igazi. Uma uphazamiseka kusuke by grace kusuke kusenaleyo nhlanhla yokuthi le ndawo ilekha i-supply but ayikapheleli. Ingakho bese bayibiza ischemic penumbra. Ukuthi ine-supply kodwa iyashorta. Ingakho kufanele ukuthi umuntu mase ebona lawo masayini aphuthume kodokotela bamsize ngoba njengoba uDr. esesho kungaba naleyo ndlela ukuthi uma kwenzeka i-correction leyo damage njengoba esesho ukuthi brain is tired. So njengoba kungenzeka ku-improve that flow to that area or ku-control leyo BP or correct whatever problem le blocker the flow. Then kungenzeka leyo ischemic penumbra, that area that is threatened, ithole i-supply futhi that will lead to a better recovery once we corrected.
Kukhona mani-prudence akusho uBamukabinde. Dokotela uthi ikwa-left number kungena bezokhuluma nge-right njani na, because my left funeka ngizwe kahle should be something izinto azihambi kahle nala ezokweni kahle.
Sorry, how right also left.
Okay, so that's the way things are within the brain.
Yes, the brain in our sections are two. Kuna the section enkulu, the cerebral. That's where the thinking processes and the memories kukhona cerebral. Then the bottom part ehlukaniseka u2 engapha cishe ngasemuva bese kuba nemthambo enjoyinayo ehle kancane mu ehle ngentana la izansi la sithi sesiphundu ngesizulu.
You say what?
Esiphundu kune cerebellum. Yona le controller i-balance. Yona I-oppose, that's just how God made us. Yona u-left wakhona usupply u-left.
Udala ngizwa kuthiwa isiZulu si-violent. But today ngiyasizwa manje ukuthi not the way izinto zibekwa ngapha. I'm sure mase sifika ku-Mteshana siyozwa even more. Because okay, but ngiyezwa is the way ingakhona bezwa ngakhona, the way ingqondo isebenza ngakhona.
Uyazi uma sikhuluma kanje sengibuka umntwana nje lapha.
Yes.
Ngoba thina sazi stroke sibishana umuntu ona 40 50 Dr Mteshana.
Ngelaphi wena?
Istroke vele siyabasha abantwana ngabe ama cases akhona statistics esithini nje vele kubantwana.
Okay, okubalekile ukuthi sazi ukuthi abantwana bayasithola i-stroke nabo.
So bangabantu.
Ukuthi ubaba uchophoma usakhula. So kuyenzeka ukuthi umntwana athole i-stroke esengaphakathi esiswini kumzali. Azabe naso. Thatha isikhathi ngusibona. Kuyenzeka ukuthi asithole i-stroke esezele noma esemdala. So kuyahlukana izigaba ngezigaba. Asijwayelekile nabo abantwana besithola i-stroke noma ngabona iklinikhi yethu esiranayo ababaningi, but ama-statistics ase-South Africa. They say Canada if unabantwana abawu-100,000 abazelwe abaphilayo, at least about 6 bazosithola i-stroke. And esijwayelekile kakhulu njengodokotela bechaza ukuthi i-stroke esenziwa ukuthi mhlambe umthambo uzoba ne-level igazi noma kuzondabuka umthambo wegazi. So esijwayelekile i-stroke ebantwaneni abasibonayo ilesi sokuthi ukublockeka komthambo wegazi. And then amahlika ayenzeka mhlambe makhona i-trauma belimele, yazingane ziyawa, ama-accidents and everything else. And then labo bantwana labo abathola i-stroke kuma-statistics bayasho ukuthi at least between 5 to 10% mortality. And abajwayele ukuthi bangasurvive ilabo abancane kakhulu aba-under 12 months. So ingakho kubalulekile nje ukuthi umzali nakhona into angayiqondi kahle avela udokotela. Ngcono kuthiwa umzali ohluphayo nje.
So siyabatshela bangamana bahluphe nina ni-understand. Okay. Because sometimes bayasaba abazali ukuthi udokotela lo uzobheka ngelinye ilihlo, but nina you're specifically dealing with this. You are trained to, you want them to come in.
Yes, unfortunately, which is also our biggest problem. Because
what problem does that give you when you say it's a bigger problem? What problem does that create? Mama figure the goodness bottleneck nyana, and then by the time I figure out what are the challenges that you have? But most people late to young service should I say anything as a hand or Mutana say we are and that's why. Oh, okay. Yeah, okay. Okay.
What else was a booming finance dinner?
Oh, okay.
Dr. Nkabinde, which is this erectile prenumerant. Gabana was whatever do my bay, and just a born and send his cat, but saying I save my air. Oh, and then what was no man disability calling Amikoko. Kodwa-ke makuzoqala iklinikhi and then they're not sure and then sekufanele nakuthina lezi because ngisebenza kwi-department ya-neurology. So ufuna aqala kune-pediatrician and luckily ama-pediatricians odokotela abantwana bayasazi i-stroke and bayasitreat-ke so bayakwazi ukuthi basi-pick up and then thina sizame sesifollowisha up nje ekugcineni nokuthi-ke sesi-involve nalaba abantu-ke amafizo nama-OT ukwenza umsebenzi ukuthi selaphe i-stroke. And in most yabo, like more than 2/3 abantwana abane-stroke bahamba amakliniki because badinga rehabilitation nabo. But okuhle kakhulu ebantwaneni njengoba ngishilo i-brain iyakhula so sikhuluma nge-plasticity kwi-brain yabo bangathi iyanwebeka so kuyenzeka ukuthi i-stroke mase kushaya ngeside leyo efanele ngama-leg akusiza let's say right hand likusize nge-speech sishift the-speech sizobaba right so ukwazi ukuthi upick up ingakho sithi kubalulekile abantu mabasheshe beze ingane sisengasiza i-brain isakhula especially mase under 5 years i-brain isengasizakala ngiyanithi abazali
ungathi Mteshana badlala stretcher
Dr. Mteshana ngiyamuzwa awuskelelana uyazokhuluma ngalokho esisakhuluma ngakho la o-blurred vision o-headache esikhuluma ngazo umntwana usengakhuluma akwazi nokuthi inhlobo lemphethe umzali osekhaya uthi akambone kanjani ukuthi uzakwazi nje ukuthi aphuthume umzali ungathini umzali kuyiziphi mhlawumbe izinto angazibona emntwaneni ukuthi okay ngathi ngisonke lesi sitokuni manje.
Okay, so inkinga kakhulu ke bantwaneni sizama ukubahlukanisa-ke ni ama-newborns laba basena like less than 28 days bese babantwana-ke so we just call them children laba include nama-adolescents ama-newborns kunzima because uzofika enesari athi sister angithi brain yakhe ayakhuli kahle like it's still early days uzofika enesari athi sister uyastop ukuphefumula nje or akafidi kahle umntwana akekho responsive i-terms nje encephalopathic ni abanye ukuthi umntwana uyaxhuzwa yabona abazuza nalezi zinto zisho usisi ukuthi ufuhlangothi akaboni kahle noma ukhumbula bazo-communicate so siyayisizwe nje ngama-observations ma-nurses ukuthi nakumoshakala so awuzocheck-a nawo udokotela and udokotela owaziyo uma ucheck umntwana head to toe then uzobona ukuthi hayi kusafana kunalezi zinto sizi-check-e ey'nganeni esanda zalo kuthiwa ama-primitive reflexes so khona lokhu siyasibamba ikhanda sigobise kanje bese senze ngathi siyamisa umntwana kufanele bathi abantwana umntwana one-stroke uzombona uzokwenzeka iside eliyi-1 elinye iside linganyakazi then ubone ukuthi hayi mani angi-investigate lapho bese bayilaba abadala laba abadala makuqhume umthamo angenzeka makwazi ukukhuluma kutshela ukuthi uphethwe ikhanda akaboni kahle and kujwayele uba emergency nje bangathi khona into ekushaya nje fast ekhanda then akasaboni and then nakhona abe-unconscious anyana and then laba abablokhekile umthambo ngiyayitshela abazali ukuthi umntwana under 2 years between 18 months and 2 years you cannot tell me ukuthi umntwana ku-right-handed noma left-handed so umntwana omncane kangaka mosongitshela ukuthi hayi ingane yami ikhula fast nje uclever u-right-handed that should be a warning sign so ama-signs obungozi lapho ukuthi hayi awukubhekisise ezinye izinto umntwana ona 12 months na-right-handed awubheke ukuthi uhamba kanjani kungenzeka ukuthi lo mntwana ushaya i-stroke kwezinye izikhathi bayenzeka babe nama-fits and then I'm sure odokotela like abantwana abadala basebenzisa le-acronym ethi FAST njengokuthi FAST so kuthiwa ama-craniofacial weakness arm weakness and then speech disturbance so abanye bahluleka ukuthola amagama abanye bahluleka noku-understand zonke lezo zinto so T stands for ukuthi it's time to go for an emergency so ilezo zinto abazali kufanele bazibheke lezo and then kuningi-ke okunye okungenzeka but lezo zibaluleke kakhulu ukuthi i-handedness omntwana ama-feet one side and then ubona ngathi ufuhlangothi ngisho noma usumazi umuntu amthakathile bese uye kadokotela
ngiyithande leyo ukuthi noma sowazi bamthakathile still man uye ungatwenza something Dr. Mathye from your side Paul Elinyi Gamala, emergency, fast one. What are the dangers? Mount emergency nanya to should very going your shabala. So what are the time frames for me to think I'm still safe when I'm trying to come to you when I've experienced symptoms of stroke?
Okay. Like kuna panga flamsel already about that acronym layer fast. It is science leti mona afana kwa lango utakoki kwenzeka yini shikanda then asymmetry or ngabo kulabula or kunabo angakutirisa shanda shoka ngaba boko kumene on both. Okay. This is affect usually it's one side. Malaka ngarumwa wabana SBS progression la kumuna paralyzed ngwa.
So it's kungabi one side nzema. I'm prove stroke as yes we one side fair. How does it should be one side? Can't depend
okay, let's look at kula absongeni. Kuna tindawo to hambana leti ti controller mavoko na milenge. So loko ri stroke leswiwani swi I've taken for the half side of the brain. Eko and kanda yo karhi eko ungaba ku ungafa side rin'we. Mara loko ri stroke leswiwani swi va xi ri le hansi nyana laha hi vitanaku brain stem area laha u nga va na problem yo u nga va paralyzed hinkwawo. So leswi ni nga ta ku hlamusela swona. Okay. So coming back to ka timhaka ta time frame. Lahayani swi na nkoka ngopfu hi ku loko wo ze ku va na ti-signs letiyani hi na nkarhi wa ka matsalwa va hlamusela at least 4.5 hours before hi nga ku nyika at least loko swo va swi humele nkarhi lowu wa u tikuma u fike exibedhlele u ze nkarhi lwani ku na treatment leyi nga ku nyikaku leyi nga sivelaku that progression of stroke leyi nga endlaku ku ku nga vi na disability in future. But loko ri ho va hi extenda nyana nkarhi wun'wana maybe even up to 6 hours mara layani loko yo ze yi fika ka 6 hours ku va na ti-challenges to karhi. Okay. But the golden time at least from kusungula ka the symptoms you need at least that 4.5 hours ku fika exibedhlele ku ta kota ku pfuna. So
sula swa bileswi Dr Nkabinde ulaka ka swa sometimes kutava ku nga pfalekanga completely sa ka hari na something tlulaka I kota ku endla swa ku hanyeka on the other side. Okay.
Na loko ku ri ku pfalekile laha ku na treatment leyi nga ku nyikaku leyi nga kota ku pfula ndlela laha.
Oh, so it so me famba ya mura me pusha inside una Dr Nkabinde Africa treatment enjani ulaka ka yo
treatment leyiwani vitana thrombolytic. Okay. So leswi swi endlaku I ku va loko ri ka an ischemic stroke leswi xa ku va ku blokekile PCI laha treatment leya leswi endlaku swona I ku va yi fika yi digesta clot leya laya pfuleka futhi.
Okay.
Ngibuyela ku-askele uma ufika endaweni yodokotela imaphi ama-test mhlawumbe abawenza kuwena
Okay, my CAT scan on the 24th. Then I went back. I went to see the neurologist on Monday. Yes, and then during that week, because she didn't know what was wrong. But I had an EEG.
So, the CT scan, washo mhlawumbe kunani noma?
She couldn't pick up anything.
My worry is that the golden time where what would you say, Dr. Nkabinde? What would you say when we are having such challenges? I could pick up, we can't pick up what the problem is, but now we are worried maybe it's ischemic, as you are saying, what do we do then?
Okay. So I'll mention the way I prefer to practice.
Yeah, no, I think that's important. That we are not judging what they've done. I think mina ngibona emergency manje senifake umthethane yasho ukuthi emergency ngathi madoda kuyafiwa. So Dr. Mathye says and explained, then I'm starting to understand there's time frames when they are talking about emergency. So ufike kuwe Dr. Nkabinde. Time frame yahamba and you are not seeing anything you can scan.
The way I prefer to do it, if the initial imaging was I bonus much, you're not happy with it. It's well within your rights as a clinician to discuss the matter immediately with a radiologist to say this image is something so akabuye naye achaze yindaba singaboni achaze mesibona okay asiboni still siya progress now. We've done a CT scan, we're not getting much happiness from it. Now I'm going to another study, probably a better information. Most of the time we'll progress to my CT angios, angiograms now. Sibuka lama vessels ahamba kanjani akunanto suspicious mhlambe ivalile kodwa isengakakhona isibena phezulu isamncisha kodwa ayikavali njengoba sekana lawa ma symptoms kuyabonakala kunokuba nama thromboembolisis le ebakhona or like uklogeke le vessel njoba iklogeka so ayikavali kusantonta kodwa akavaleki so nama signs umuntu ngaleso sikhathi.
That's why abana nama signs ezakancane.
Okay. Lento iyavala kodwa ayikavali completely. So uma kwenziwa further imaging kungenzeka sibe nenhlanhla ukuthi sithole ukuthi nayi lento la ifuna ukuvala khona ivala ku supply. Then sekungenza ngama agents Dr. Mathye akhuluma ngakho.
Okay.
Either we employ those or mhlambe sithole interventionalist, mhlambe a radiologist or another neurosurgeon owenze intervention. Akwazi now to try and go into that vessel azama ukubona ukuthi can he remove leyo agent le evalile na. So preferably lokho engingabona ukuthi let's investigate further. The way we practice,
but it's hard, you see, because ngibheka uzoyenza there and there, ufonela there and there because uyabona ukuthi akuhambi kahle. They show i-radiologist.
Ayifuna kuye same time.
I think ile ubengifuna ukuzwa kahle ukuthi would you do it on Monday nje or Friday later, or it's something that you then do it.
It's as we have said.
Yeah.
And I think everyone we have
imagine.
Okay. So listen to me quickly. Funa ma answers and wafuna masinyane.
Okay. Yabona prove. Yangichaza because mama lokho bakhuluma yezwa ukuthi besicount isibizo wonke umuntu bekunama interventionist ngiyiphikhile igama mina intervention so ufike kumfune lo muntu next time eze la naye sizwe ukuthi kuyenzakalani because uyayazi interventionist wena udokotela so ngithembe wena mina ngiyakhuluma nje
ngiyabona ukuthi iyashoda nge-radiologist kulamateam ethu ngoba kusho ukuthi udlala indima ebalulekile ngoba ungaze yena ayimise lapha ku-CT scan
uyacomplain Nkabinde uyawuthatha ifoni sometimes umfuna la so bengimfuna ehleli lapho naye ngizwe ukuthi kanti mase kuso kuyenzakalani, then we move to the next level. But I think this is interesting and sibonge ezempilo because siyafunda and I think nababukeli ekhaya bayabona ukuthi indeed it's an emergency. I think important word engiyifunayo la ukuthi i-stroke ungathi emergency. Bengicabanga ukuthi nje kuyenzakala uvuka masa emergency kuphi lapho bese kwenzeke, but ungathi kukhona la lokungenza ukuthi ungabi nama impairments or disabilities amakhulu if ushesha ubonisa abantu.
Ngizwe ekhuluma ukuthi usethe lapha phansi ungathi lento sithi mini stroke. Dr. Mathye, Can you take us to yini uhlala kubezwa nababukeli namhlanje bathi mini stroke asichazela ababukeli namhlanje ukuthi yini mini stroke namhlanje.
Okay, ekanyingi babazi ukutala lokubona babe na mini stroke. Lokho kuma kube na the signs that stroke leti tingayela resolve at least within a period of 24 hours. Leswi switanaku TIA, transient ischemic attack. So they shall show a mild stroke.
Okay.
And kubana the signs that are after 24 hours, they might have a completed stroke.
Okay. But the body, the resolve within 24 hours, is it through intervention or don't resolve and then right? I mean, look, sometimes it's something, I need to resharpen and then look, but just maybe I could mild. Then these guys are right. What are the dangers there now that if there's anyone a mind, needs having a mind, what are the chances of having a severe or a more serious stroke at that one?
Okay, so look at a mild stroke or TIA. The signs that they are resolved by a torch, is built up now. Solve at Mahaleta, Susa Trot, Marlo, Miro, and Otsandela Susa Trot, Ebe Kubaku, Loka Lukia Semani, Fala, Zialua, was a manji, Kubakuna stroke, a completed stroke. So this clean up on a local Kubinami stroke, Hebu, got chance Yaku Ongapu stroke later on. So, Una risk Yaku stroke within 28 days or Longa Roko Uya. Election nice and up local the risk that or financial a control risk stroke how do you control the risk factors and the medication yielding up who I preventable who stroke food.
Is it not important to utumbuze ukukhuluma ngaris mina ngazi ukuthi ukwenza la ngazokhuluma ngaris aya prevented.
I was telling Dr. Mathye, ama-risk factors, imaphi ama-risk factors okhuluma ngawo. Ngizwe akhuluma ngokuthi genes, ingane zamamuhayi, ntwina, is it genetically vele? Lama-risk factors awusibekele wona, uzidlalele wona, kanti futhi uyicacisele le ndaba yokuthi ngoba vele sizothi masimshaya, but it's in the genes, kuhambe ekhaya. Singafuni usizo.
Okay, so look, when I'm stroke, the risk factors to move. Marabona litinga ehlangana most commonly. So far high blood, diabetes, high cholesterol, so far age, if you are above a certain age, especially for if you are above 55. Risky awareness stroke here at Lolo. Baba Sati, if you're above 60 and 65, risky awareness. If one of the family history genetics, you call there's a component here genetics. Like one certain genetic disorders related to they were predisposed to the risk of stroke. Okay? If Lambotana, Sofana, Konati Shahatuman, Namsavi, there are certain races. Much higher risk compared to level 1 for boy stroke. Go some races like Europe. Again, if you're looking at Indians, Pakistanis, risk compared to one. So there's that element. If you want the risk is one, I found tolerable to so called. Kuna one ungaba let's say vajambilu uzalo ornazona or ji ukuma bathi lejwana ukukula ibe se affect ambili ya wena and then utukuma ubuye stroke kuna the infections to car related tinga tenda ku tisabo risk ya stroke in our setting we have to talk about HIV as a strong significant risk factor for stroke. One of the infection with the meningitis, na yona ingaku young risk stroke. ku va na mavabyi ya ngati self loko ri ngati ya wena ku na swin'wana swi xotaka la mirini la ngatini ya wena leswi a swi fanele ku va na balance because normally miri wa munhu wu loko ku va na balance check loko ku ri ku xota swo karhi swi nga endla ku va na risk.
Interjectanyana dokotela loko u vula ngati ngati blood but sesingele va vula hi ti-blood bags somewhere yini leswi va vulavula ka swona va mi byele leswaku va le mulitsori maybe platelets problem and stuff.
Yeah.
So if
This was an explanation, sorry, after I had had a hemorrhagic stroke.
Oh, so already it was a hemorrhagic stroke.
Yeah, I had a hemorrhagic stroke 8 days after being admitted to, and I had to force the doctor to have me admitted. So 8 days later.
So, immediately hemorrhagic stroke, 8 days
after giving me that numbness.
So there was
yes,
a period of 8 days. So this emergency element that you were talking about becomes very important because now I understand Dr. Nkabinde's approach that says, should I not pick up this, I will do this immediately so that I try and avoid further complication. I think this is very important because it's fundamental.
Khona manje pandemic
COVID.
And ngiyeva kancane bakhona futhi abane COVID ne-stroke. Kodwa manje awusirelated lapho usifundisa ukuthi khonakalani i-COVID ne-stroke.
Okay, yeah, kangaroo sweswiwani as we living in the pandemic, kube na ti-case leti ti nga kumeka la ku nga na vanhu a va kumeka va ri na vuvabyi bya COVID and then va va na stroke. A hi swi swa ntolovelo ku swi vona, it's not common. And hakanyingi loko va languta vanhu lava a va nga na COVID va tlhela va va na stroke, vo tala va vona a va ri already a va ri na ti-risk factors ta ku va nga bohe stroke. And ku nga ti-risk factors leti ti endlaku munhu a nga va na severe COVID at the same time. So loko va languta vavabyi lava va kumaka no a ku ri vanhu lava va nga malembe ya vona a yi ri henhla, va na ti-high blood, va na machukele, there's obesity involved as well. Mara xin'wana lexi nga kona i ku ha swi tiva ku COVID na yona hi ku yona ya endla ku u nga va na stroke because yi endla it predisposes to what we call a prothrombotic state, leswi endlaku ku u nga clot.
And I think this is where Dr. Nkabinde comes in. And I'm not so sure about Mteshana because Mteshana is but Dr. Nkabinde, through this period of pandemic, I'm not so sure if you been operations and stuff, would you have had an experience of such things where you're too busy? I think being busy, TV busy, clotting problem too easily. I don't know what would have been a problem. Did you go through experiences of difficulties while you are operating this pandemic time and then think there might be challenges that are related that may end up causing stroke to some of the patients?
Not necessarily during this COVID time.
Yeah.
We haven't had such challenges.
So those were experiences in other countries.
In other countries or other centers, but in the center where I work.
Yeah.
And the other thing with thrombotic events, it's something that I feel just we need to bring forth.
Yeah.
Because Dr. Mathye abantu abadala abanama-problems enhliziyo bangagcina baba nama-stroke, kubalulekile ukuthi siyibringe forward ukuthi nasebantwaneni iyaba khona le problem. Umntwana uma azokhula noma azalwe ane-congenital heart disease, iyam-predisposer to thromboembolic events because aba-clotting ngendlela e-right, but ngicela ukungachazi further because
of course uzoyithatha masoqede Dr. Mteshana siyazi kumele wena nje But this is quite also interesting, and Tanda the way abodokotela bethu baya ngakhona. Uthi makafika la afika uthi hayi Dr Nkabinde yakho, Dr Mathye yakho, Dr Mteshana yakho. And I think that is important to work within the team. Mteshana, ulahlele intambo
Okay. Yeah, I was going to say relationship good between team and neurosurgeons because one thing this is dystrophy. I respect as a stroke. So before we touch the inhliziyo, all common is one is for eslasela umthambo wegazi. We call them vascular puppies. So we khona into ezodla nje umthambo uzuzaca bencane uthola ukuthi sengisho into encane ngale igazi asahambi kahle. So lezo zinto eziningi esizibona abantwana ezibangama infections. Siyasibheka umntwana ne-stroke engibathi le right ekhaya. And the question I like to ask ukuthi lo mntwana akazabe ne-chicken pox yini? Ngoba i-chicken pox nayo eba predisposed to a stroke. Kodwa ke angisho ukuthi yonke ingane ne-chicken pox
uzothola iroom yakho igcwele babantu abene-chicken pox.
Mine stroke izama ukubheka ukuthi yini ezingesinamanye ama-infections udokotela bamentionile-ke washo nge-HIV. Abanye abantwana khona lento ehlasela umthambo wegazi siyibiza nge-moya disease or moya syndrome. I-moya disease is in South Africa, iseJapan.
Ngizongathi igama lesizulu. Phela ngicabanga maybe language yangale eSouth eKZN bakuthi mawune-problem bathi hayi moya.
Igama livela endleleni imithambo yegazi ebeka ngayo i-CT angel because ubona ukuthi mincane imithambo yegazi bese banama-extra vessels kuthiwa it looks like a powerful spoke. Akazobigama laseJapan. Thina-ke abantwana esiwaredi ngabo ukuthi bangathola leyo abantwana bane-Down syndrome. Abantwana bane-Down syndrome siyazi ukuthi bangazalwa nenhliziyo inenkinga. Risk in our moya disease. So before umntwana ne-Downs on a stroke, sesine-idea ukuthi ufuna sibheke kuphi. And then bese bakhona nezinye izifo. And then bese bakhona nje i-dissection asiyazi kahle, i-dissection kahle ngisho ukuthi nje bekhona into ezoqhubisa umthambo wegazi, but ungaqhubi completely. Bene-flap ethizeni nje izoloku interfere ngisho with the flow yegazi.
Yes, amabakhuluma nge-dissection.
Yeah, so like more than 50% of my stroke ebantwaneni ilezi zifo eziaffecta imithambo yegazi. Bese siyangena-ke enhliziyweni. Abantu bayazalwa nembobo enhliziyweni, abanye baphathwa inhliziyo sebebadala. Yabona emva kwama-infections athizeni uthola ukuthi umntwana setune-rheumatic heart disease. So labo abazalwa nemithambo yegazi nabo-ke ba-predisposed to ama-prognotic states. And ngaphandle kwe-problem yokuzalwa nembobo egazini, kukhona ama-interventions enziwayo udokotela benhliziyo. Mabethi sifuna ukubheka ukuthi i-damage ingakanani before senze i-operation into e-angiola.
So sesifuna cardiologist now. So sishoda ngekhaya
So mabenza lama-procedures sometimes kuyenzeka kube nama-complications. Umntwana abuye sebuya ne-stroke theatre. Or during the operation itself, so iyafikswa-ke manje imbobo enhliziyweni. Kube nama-complications abantu abathola i-stroke. And then kuningi okunye sebekumentionile odokotela ukuthi abanesifo sokuklotha kanjena. Ebantwaneni into esijwayele ukuyibheka, especially laba ama-less than 28 days ama-neonates. Besibona ukuthi lo mntwana une-stroke ade siyabona ukuthi une-clot. Siyasibuza umzali ukuthi qala ukhulelwa awunayo yini amanye ama-miscarriages. Sifuna ukubheka ukuthi le nto isukaphi kahle kahle ngoba kungenzeka ukuthi isuka kumzali. So kungenzeka ukuthi labo abamiscarriage mhlawumbe i-stroke isaba both sides of the brain and then bangasasurvive. So lezo zinto siyazibheka. As much as abantwana sithanda ukuthi abantwana bakhulu bawobehave okugela okuboy ama-drugs. So labantwana baka-civic clue abathatha i-cocaine nazo zonke lezo zinto kungayenzeka ukuthi ube ku-risk ye-stroke. Also now namanye ama-risk factors. And abantwana babona aba-under 18 I would like to think ukuthi nje baziphethe kahle ingane ezihamba umhlanga kodwa-ke ama-contraceptives nabo akafiki without ama-complications so nawo angakufaka kwe-risk lokuthi ube ne-stroke so yizo zonke lezo zinto esizibheka nokunye okuningi mayikhuluma nge-hemorrhagic stroke-ke sesibhekane ukuthi khona yini history of trauma wake walimala or maybe unezifo especially abantwana babafana khona into ekuthiwa i-hemophilia laba bavele bophe nje like engashayiwe nje ufika nedolo elingaka abanye kuyenzeka bavele bophe kwi-brain and then because of the condition abanayo so yabo maseyisuke into zayo nabo ukuthi ayisakhontrolekanga kahle labo ntwana bakuriskile lokhuza i-stroke
yazi ngiyabezwa information ngiyayizwa yagcwala and I'm hoping nababukeli basasilandela because in between ngiyezwa cardiologist intervention and there was something Dr. Mathye wayikhuluma nge-age ngacabanga about uAusengele when she had the problem. It was at 42. I mean, I'm assuming 42 is, quite an early age where you rarely think of stroke at that point. Maybe the reason people genetic things and so on and so on. But in that aspect, how easy it is, or what is the prognosis chances of her recovering to be, recover a little bit better if you have intervened with the age that we are talking about? So 42 going down or 50 going down, what are the chances of the recovery of activities of daily living and the condition itself?
Okay. Age plays an important factor towards recovery. So lokho untsongo unganamabanje lamangani and ufika esibhedlela enkadi you get the right treatment, there's a very good chance you will recover and then your life can go back to normal. Whereas kaba laba bakhulu sewayakhula obanamabanje, let's say una high blood, una chukela lathelo, maybe nakwazi the kidney lokho stroke already umiri wa wena uhlaseriwe isotana leswi swi nga affecta ku recovery na lifespan ya wena in general. So ela ungana kuhambana but that's where the difference is.
Uchazile Dr. Mathye ukuthi bapha treatment lokela nalokela amaphilisi abawaphayo nje Dr. Nkabinde ngifuna ukwazi nina ukuthi kulawo mhlobo sebeshilo le-stroke nina yini nivulayo ni-operate kanti uma ni-operator ama-chances ukuthi ningaphumi lapho lifile uhlangothi angakanani? Ngicela nje ukusithathe nina-ke as-neurosurgeon.
Ngizoqala just ngifuna ukunikeza quick background ukuthi before sifika ku-stroke kufuna si-understand ukuthi sekukhona okusuke kulimele and before sizofika emthanjeni elimele sibuyele emuva futhi ngizothatha i-hypertension ngiyenze as an example. Sahluleka ukuyicontrola kahle le hypertension ngoba that is where in medical treatment plays a bigger role. You're trying to make sure that these vessels stay functional, they stay intact, and there's organs that are being supplied by these precious vessels. They are preserved. We always re-emphasize the compliance with the treatment, because if that is not the case, it can be controlled the blood pressure. The damage kunama organs that will be deprived of the blood supply, and because now the flow is high pressured, kula vessels, then you get development kukula ama vessels lawa angasiright, so kuzoba nemthambo emncanyane le ekhulayo and ayikhuli ngendlela eright, iyashesha ukuthi bese iyopha my under pressure leyo mthambo leyo. So ukunikwa i-treatment kusuke kuzanywa ukuthi ku-prevent le problem lezo result kwi-stroke. So manje uma kwenzeka ukuthi le mthambo emncane le idabuke, angeke sisakwazi ukuyilungisa thina le mthambo, bazosibiza noma nabo sekune-clot ukuthi asizolisusa, sisusa lehlwini
lisusa blockage le or
Sisusa lihlwili elikhoza
Oh,
pressure. Angithi
okay.
sekudabukile
Eh.
ingabo ngitheni thina siza sekunenkinga.
oh kuba seku-complicated ngapha
Kwangapha kwa Dr. Mathe no
No,
Dr.
Dr.
sekuza ngapha kithi.
and I think this is quite important because it you know njengoba bengilalele u-Auske, what you're saying now nokuthi makuba ne-complication, how important is it to explain or nichazele the patient before ni yenza le treatment uthi azi ukuthi kungenzeka kube right or kungenzeka kungabi right because we are trying to control something seyiyenzekile. How important is that part? When do you take a patient through this? Because uyakhala ufuna uncedo at the same time. So manithatha isikhathi sachaza nenzani, how do you go about this thing?
Okay, swi na nkoka ngopfu ku hlamusela muvabyi ku endleka yini and then na treatment leyi mi nga ta n'wi nyika yona na switandzhaku leswi nga va ku kona. And loko ku va mi nyika treatment leya patient u fanele va a swi twisisa and u fanele a mi nyika consent laha a fanele a sign ku wa swi twisisa ku humelela yini treatment leyi mi nga ta n'wi nyika yona na ku mi hlamuserile ku ti-side effects ta treatment hi tihi. Mara loko ri patient yena self a nga koti ku mi nyika mpfumelelo, then leyi nga kombela ku next of kin hi va hlamusela hi xiyimo xa yena na ku hi lava ku endla yini, hi ta n'wi nyika treatment ya njhani, and then nkarhi wun'wana ku nga va na switandzhaku or ti-side effects. So leswi a swi na nkoka ngopfu. I think na le ka side ra Dr. Nkabinde a nga mi hlamusela va ya
swiendleka leswi because anything can happen.
Yes.
Yes, that's true. And the main thing with patients must be figure ku neurosurgery baba refer khona is because sekune pressure effect.
Okay.
Lokuthi manje life say threatened.
Okay.
ngaphambi kokwezwayo Auske ule awufetha bawalapha hospital ukuthule jwang kanti king okay butsa maybe dingaka ka je gore if maybe no right 1 2 3 kabe ke right or king o ka srata gore ka je maybe o ka ruta ringa ringaka gore lukisa kwa and yeah just
And maybe before you finish, just to add on that, to say, when like how we doctor, what were your expectations? Where at that point?
Because already I had like since the signs, these are signs of an impending stroke.
Oh.
So that's why I killed the hospital. So older than it took like 2 weeks for them to advise giving a stroke, hemorrhagic stroke, which could have been prevented. Make it quite
Yeah, I wanted to hear that part to say, how did you feel? And how are you feeling? Because how I'm not a greatest assessor, but just to mamela the voice, some of the things didn't sit well with you, and it's 9 years later today. How have you been dealing with this aspect?
I went through the grieving process. I went for the person that I was before, and I had to go on. Oh, and also I joined this group, Stroke Survivors Foundation.
Okay.
Where there are a group of survivors, and we are able to talk
about
yes, our.
And then how many members that does group have? Because it's very important I'm mentioning this. You know, at some point I do remember there was a group of guys who were looking to start an NPO of some sort that will raise funds such that you could, these people with problems like this can get attention a little bit more regular. While they are having the group that they are saying they are survivors, there should still be challenges that may need to be addressed, but funding being a problem, then you would have, you know. So how many members does your group have? Because somebody might be looking here or watching and realize that, okay, maybe I need to look at this group so that we try and fund it and it tries and help these people with this kind of problem.
Okay, there are 8 of us.
8.
Office, yeah.
Okay. Or in an office?
Yeah.
Okay. So is it an office of your group or
Of the
where
foundation.
of the foundation? Okay. But does it have other members outside the
Yes,
office?
yeah.
How
We have-
many
We have
members?
people all over the country.
Okay. And what would be the estimate number that you maybe at the top of your head if you have an idea?
I mean, it can go create a support group in about maybe 100.
Okay, so that's quite a huge
But
number.
happy we don't have we work with existing groups that have been operating here.
Yeah, okay. So
So we partner with universities
yeah.
and therapists there to hold even part those groups.
And it becomes quite interesting too, when you think she's been there 9 years going through the challenges. And you can see, you can hear from the language, I mean, primary healthcare aspect has been dealt with here, but there's still the remnants of the problem. That maybe there are things that she might still want to be done if it was possible to be able to move from a certain point and help other people even within that problem, that space. And I think this should be a great lesson within the medical professionals ourselves.
Yes.
We have done whatever that we have done. We have let her go. How often do you go for checkups?
Every 6 months.
Every 6 months. And do you think something could, between me and you, within 6 months, do you think we could miss something that would be frustrating her on the day that she comes? Maybe she's okay, but in between there would have been so many things that happens that we might have missed.
Ngiyacabanga ukuthi kuningi awusikele ababengasitshela khona kanti vele kuningi nathi singaba bezempilo esikumisayo lapha ngoba vele uma asekhaya I think vele njengoba sizochaza nama-psychologists especially psychologists psychologists awusikele wayithola nje psychologist wena?
Yeah, I did.
But after how many days?
Who sent you there, or you decided to find it by yourself?
No, I went to the physical rehabilitation hospital.
Yeah.
So you have to have a counselor.
You see, so this is an advantage of her. I wonder what happens to people who yeah, but where some of the rehab specialists we had here do not exist. What would be happening in such situations?
Neurosurgeon
And offline at some point, we were talking, Dr. Mathye was fascinated about some of the things that were being said. And he thought, man, there's a point where the chain gets broken. Maybe we need to try and fix it and make sure that this chain, it's always neat, such that the services can continue. And I'm saying this because when you look at 6 months and so on and so on, yes, she is a psychologist, but it might not always be that it's addressing everything.
Ngithanda ukubuza Dr. Nkabinde. Siyazi ukuthi i-stroke singeza kwesibili, singeza kwesithathu. Esi-neurosurgeon ninayo indlela yokuthi ningasipreventa ukuthi singabuyi esinye i-stroke ku-upscale.
Now I would want to hear what are the things that could be, that could be done to try and prevent the second coming, not of Jesus this time.
I think the question is more related to
Okay.
it's a medical issue.
Okay, so from tlhelo ra hina ku na leswi swi vitanaka secondary prevention. So laha hi langutana na eka patient hi languta mavabyi ma yena swo a cheka ku okay swo fana na blood pressure swi control loko ri munhu a nga na chukele chukele ra yena treat control loko ri na vabyi HIV we deal with that. We advise you on lifestyle modification as well. That's what like fall or drugs, exercise as well. There's also a room as well for dietary advice. I think that is almost important to everyone. There is that component. And then maphilisi lama emanika na lama funa ukuprevent abana sofana stroke. Anika sofana na disprin and then anika so this control cholesterol.
Disprin ulale itirizaka for nhloko pe logo itwaswa kuinandruko disprin. Itwaswa kuina headache because we get used to some of these things, disprin, grandpa, and we just take. How dangerous is it for me to be using it all the time if maybe I didn't even have that? Does it help me to prevent the first coming of stroke?
Okay, so una dose level interesako prevent us.
Oh yes.
I find na dose level interesako.
Not the castrate.
Yeah, prevent us stroke. It's usually a lower dose.
Okay.
And then you call a risk ya ko bleed or ngaba the Alzheimer's. I shall come stalango flogo utireta dose ya le and over utireta ma pills la frequently.
Okay.
And la ngaba risk ya ko
Dr. Nkabinde.
Whether I'm doing it, I think it treatment yafana nathi secondary prevention i-dispenser esebenzisa and then mabeney'nkinga zenhliziyo sesifuna ifixwe siyabathola nathi abantu abane-high blood pressure but most of the time so i-problem isuka kuma-kidneys so we would involve those people ukuthi mabafixe leyo nkinga yakhona ama-kidneys and that being said as udokotela abantwana siyithanda i-disprin kakhulu ebantwaneni ngoba iphindile nama-complications esibindini sengane so umuntu makangavele asuke ekhaya nje athi unasi-stroke na-disprin and nathi i-disprin uDr Mathye angavumelana nami ukuthi siqale sibheke kwi-scale ukuthi i-hemorrhagic stroke lena noma ublockade because uma umuntu ofika vele sebleeda vele is a result here asiyiniki disprin
Because
izosmosha so umuntu makayeka nje kusuka ekhaya nje unasi-stroke thatha i-disprin
Okay.
akaqalaza udokotela ukuthi uthi
I think bayezwa ekhaya nakuthi i-discipline the self-medication nayo funeka ibe controlled because more often it is created inkinga size sicabanga ukuthi hayi abathandi ngiba successful ngapha next door bayangithakatha kanti ngiyasithakatha ngokwami na everyday ngiloko ngithatha la maphilisi angagavenwanga ngumuntu ungena umuntu ongigadayo ukuthi kuya. I think this is quite an important aspect because some of these things we uzwe abantu mabafika every time it's been 3 months ngiloko ngithatha ngiyabona kulungi manje sekunamanye ama-problem asazi ukuthi and I think we need to try and prevent that as a way of treating people by not having to go to the doctors first but making sure that their lifestyles are covered. The lifestyle is a problem on its own. Except I'm fine. You see, Bonamani, please, but it was jail. So Funabas was jail afterwards. But do you guys maybe work hand in hand with your physical therapist in the sense that when I think of exercise, this is some of the most painful thing that I have to do, and it can be very painful and decide I am not doing this, and it messes up my lifestyle. But if I find somebody who does it and does their specialty and guide it to a point where I'm able to enjoy it, I might find ways of actually changing my lifestyle much easier and adapt to it in a long term so that I don't run away quite easily. But how's the relationship there while we are working towards trying to prevent things like this of stroke?
Okay, so as physicians, we are part of relationships with a number of multidisciplinary team.
Yeah.
Treatment stroke. you need a physician, you need a neurologist, you might need a neurosurgeon if needed. The allied team I've gone along before, including your psychologist as well. So it's actually a big team. So Logostaka exercise, I can advise the patient to find exercise and journey. But the physiotherapists and occupational therapists now they put a hand. Okay, look at stroke, you will apply exercise. But how much can this person do in terms of exercise and also exercise here now. If you have many multiple comorbidities, it's okay, no. When exercise here, you cannot do strenuous exercise if you are normal. So we have limitations to that. But I will tell you, exercise, I enjoy one to lose weight. But you have to control the blood pressure, control the sugar, the one, my family as well. And also longevity as well. Look, blood light matter, good exercise, especially
exercise. So as a way of us parting ways, a last message to the listeners regarding stroke, the prevention, more especially in the kids' environment. What would you say to the listeners, those who are watching, and the parents in particular? Because we have these very small babies that you rarely see what is going on. Those that can be able to talk, at least they can tell us what the problem is. But what would be your parting message to parents in particular, those who are having small kids who can talk, who can do certain things all the time?
nehandedness lebengisho noma umntana mayihambe yogoma osista mabancheck ukuthi udevelopa ngendlela right yonke into isahamba kahle. So lo myalezo abona abazali kuphela nasemakliniki kufanele abantwana ba-check kune-page lelabhuku, so akuseyona i-rotural card manje seyincwadi. So kuyabhala ukuthi umntwana mayina-12 months funayo useyazama ukuma sizohamba zonke lezo zinto, so funa batheke and ziyashiwo nezimpawu zibungozi ukuthi yabona. So ufuna sisebenzisana nabazali and into engiyakisho ngiyakithi umzali uhleze right because uyena udlala lena 24/7 ngcono bezicathe ekliniki, but at least wazi ukuthi umntana wakho alright, and then if you're not sure you can always ask.
Khona le thambisho uma umzali but yena wathi ayifuneka ngithatha abantu abayithu kuzokunceda ngamanye nabantu abayithu. But kuba nento la between umzali nomncedisi la ekhaya uthi hey, how the problem, how do we bridge that gap when they tell us information that is so important about kids, the domestic workers, when they are giving you a message but you are having issues between ungathi uyafika ufuna wena uhlala uya kwa doctor so that asala ngeli TV akubithi ezempilo sikhuluma ngalezi zinto uyozichecka lapha. How do you navigate through such things?
Ngicabanga ukuthi umzali okwazi afford ukuthi abe help, they should be educated enough ukuthi babone ukuthi izinto azihambi kahle nokuthi bajudge ukuthi lona ufuna ukuvilapha noma uqinisa yabona. So nawe ingane yakho ukuthi une-help endlini akusho ukuthi seyiyonzalo enzelekile nawe mawugeza ingane nje awugezi nje usheshise uyam-check umntwana any scars and things like that. That's when you can see ukuthi hayi lo mntwana uyasmile but ubuso bulingane le side wide ingamuvi njalo uma ngimnikeza something nje ubamba ngalesi sandla akafuni ukusebenzisa lezo. So umzali naye angaka-confirm before ahambise umntana kadokotela otherwise yes sizodlala abantu
Awusikele asenze ritual okanye kuba nguvile kumhanye ukaba wona hore ha bona the symptoms by the ritual
by hospital ba tlhaganela ba hospital ke itse gantsi government hospitals you can't just walk in but go ahead to clinic but to the referral you are in hospital
nisizwele nalapha emakhaya nifundile futhi kabanzi indima edlalwa odokotela abahlukahlukene sizobuye sibone futhi ukuthi ama physiotherapists ama psychologists nama speech therapists adlala yiphi indima next week ningaphuthelwa ezimpilo zamutakalo with Dr. Pro lo ungavalelisa emakhaya
hayi sibonge sibonge ama guest wethu bekubuhle today mina ngulutendo emsinandela manje sinandela chibona kuyafenda basi never world nda